Welcome to our CNA test preparation video. Today we'll be diving into the CNA certification process, which is, a crucial step in becoming a certified nursing assistant. Preparation is key to success, and that's why we're here to help you get ready. In this video, we'll walk you through a series of questions and provide detailed answers to help you understand and retain the necessary information. So, let's get started, shall we? Disclaimer. This video is for educational and practice purposes only. The content provided, including questions and answers, is designed to help you prepare for the CNA certification exam, but it does not guarantee certification or a passing score on the exam. Always refer to your official CNA program materials and guidelines provided by your state or certifying body for the most accurate and up-to-date information. This video should not replace professional instruction or hands-on training. Follow your healthcare facilities policies and procedures for patient care. Let's move on to basic nursing skills. Here's our first question. What is the normal range for adult blood pressure? The answer, the normal range for adult blood pressure is generally around 120 over 80 millimeters of mercury. Next question. What are the key steps for measuring a patient's blood pressure? The answer, first, place the cuff around the upper arm. Then, inflate the cuff until the brachial pulse is no longer felt. Slowly deflate while listening with a stethoscope. Finally, record the systolic and diastolic pressures when the first and last sounds are heard. We'll continue with more nursing skills. Questions such as how to check pulse, temperature, respiration, and so on. Now, let's talk about personal care skills. Our first question is, what is the correct way to bathe a patient in bed? The answer. First, gather all supplies like washcloths, towels, soap, and a basin. Ensure privacy by closing doors or curtains and covering non-washed areas. Wash one body part at a time, starting from the face. Rinse and dry each part before moving to the next. Next question. What are the key steps for changing an adult brief? The answer. First, gather supplies such as a clean brief, gloves, and wipes. Turn the patient on their side. Remove the soiled brief, clean the area, and replace it with a clean brief. Properly dispose of used materials and wash your hands. Alright, let's dive into Section 3, Safety and Emergency Procedures. This will take about 7 to 8 minutes, so hang tight. Question 1. What should a CNA do if a resident starts choking? First, assess if the person can cough or speak. If they cannot, perform the Heimlich maneuver immediately. While you're doing that, call for help and keep performing first aid until professional help arrives. Moving on to question 2. How do you assist during a fire evacuation? Follow the RACE procedure. Rescue, alarm, contain, extinguish. First, rescue anyone in immediate danger, then sound the alarm to alert others. Contain the fire if it's safe to do so, and finally, try to extinguish it with the appropriate equipment. Make sure to evacuate residents who are in immediate danger first. Use appropriate equipment, like wheelchairs or stretchers, if needed to ensure everyone's safety. Alright, that wraps up our section on safety and emergency procedures. Great job sticking with it. Section 4. Infection control. Let's dive into some essential questions. Question 1. What is the proper technique for hand washing? Answer. 1. Wet hands with clean running water. 2. Apply soap and scrub for at least 20 seconds. 3. Rinse hands thoroughly. 4. Dry hands with a clean towel or air dryer. Question 2. How should a CNA handle contaminated laundry? Answer. 1. Wear gloves when handling soiled laundry. 2. Avoid shaking the laundry to prevent airborne contamination. 3. Place the laundry in a designated leak-proof bag. Section 5. Communication and resident rights. Now let's go over some important aspects. Question 1. What are the basic rights of residents in long-term care facilities? Answer. Residents have the right to 1. Privacy and confidentiality. 2. Be treated with respect and dignity. 3. Make decisions regarding their care. 4. Be free from abuse and neglect. Question 2. How can a CNA effectively communicate with a hearing-impaired resident? Answer. 1. Speak clearly and at a normal pace. 2. Face the resident and maintain eye contact. 3. Use gestures or written communication if necessary. As we wrap up, let's recap the key topics we covered in this video. We've discussed infection control, communication, and resident rights. Remember, it's crucial to practice regularly and continue studying for the CNA exam. For more help, check out additional resources like practice tests or CNA guides. And hey, if you found this video helpful, like, share, and subscribe for more. Disclaimer. This video is a practice tool and should not be considered a substitute for formal CNA training. We recommend consulting with your instructors or professional resources for additional guidance.